Good afternoon. Welcome to another program here on Islamic Shura Council TV, our health program. My name is Dr. Zachariah. I welcome you and your families. I invite you to give us topics that you want to see or do you want to hear about. If you have interests or curiosity about any medical topics that you're interested in, we can cover it and discuss it. And please comment in the comment section, or you can also send us an email. That would be wonderful. If you have any specific topics you want us to cover, please don't hesitate to share that with us. Today we're general anxiety disorders. We live in a time where there's a lot of worry and there's a lot of stress. And what we need to do is, or what we try to do is, minimize our stresses. But unfortunately, sometimes the stresses get so much where we get persistent anxiety, and if that anxiety doesn't quell down or doesn't get better and it persists with us, then it becomes a disorder. And what we want to do is we kind of want to define the fine line where normal worrying, turns into an anxious disorder where we need professional help and treatment for it. Of course, we have lots of coping mechanisms that we have to deal with our stressors in life. Everybody, the main stressors in life, where they tell us, the scientists tell us that, to move is a huge stressor, to change relationships or get married is a big stressor here, and then also to change jobs or a vocation. Those are the three major stressors that cause anxiety in most people here living in the U.S. So a change in job, a change in location or housing, or a change in relationships. These are the three things that are defined as causing the highest amount of stress in people. And now the other side of the coin is, how do we deal with this stress? What do we do? Do we have meditation techniques? Do we sometimes go into what's known as cognitive behavioral therapy, which is up and coming and utilized in a lot of counseling, and therapists utilize CBT, cognitive behavioral therapy, for anxiety disorders, rather than just throwing drugs at it from a psychiatrist standpoint or from a doctor's standpoint to calm things down. So anxiety disorder, the normal worries of life we all have, but we cope with it, right? We have things that we'll worry about. Something will come in our head. We think about it. We think about the solution. And then after a few minutes, it's gone out of our minds. But the disorder is when we have the frequent worry that interferes with our daily life. So this is the key distinction. It's a frequent worry that interferes with our daily life. So your normal activity of daily living, waking up, taking care of yourself, taking care of your hygiene, going to work, dressing yourself, cleaning your house, taking care of your surroundings, all these normal daily living activities that you do, you continue to do it. But if you suddenly get a stressor or a worry that prevents you from doing these activities of daily living, then this might be something where you need professional help, or you need your doctor, or you need a little bit more than just the normal meditation or the thought process or your friend that you talk to. So that's one of the telltale symptoms, is when you have a worry that interferes with your daily life. That might be qualified as a anxiety disorder if you're anxious about that issue consistently and persistently. The other thing that comes up is if you have a fixation or a fear. If you have a fixation or a fear of having some type of stress about that issue, or some people might have, I'm going to have a panic attack. What's happening? Yeah, this thing is happening in my life, this issue, but I'm fearing that I'm going to have a panic attack about it. If you fear that panic attack, then it might be a anxiety disorder. Also, there's people that have anxiety disorders, they get nightmares that are recurring. It's continuous. It's not something that you get a one-off nightmare that happens once in a while. It's something that it's recurring nightmares. You get sort of flashbacks, and you get sort of like a PTSD, a post-traumatic stress. You think about that situation, and it gives you anxiety. You start getting the palpitations, which are the fast heartbeats. You get that quick, shallow breathing. You get hyperventilation, and some people might actually get cold sweats as well. And this is something where if it gets to this level, then we know that it is an anxiety disorder. And for that, you need professional help. And we would recommend, our recommendation is always to tell your doctor, call your office, doctor's office, and the least they'll do with you is they'll do a telehealth conference with you, and they'll discuss things with you and ask you what's going on. And then the other thing is, if you do get that panic attack out of the blue, when there's no reason, there's nothing apparent that you're thinking of, and you suddenly get that panic attack, then you get, the sensation where you're getting the fast breathing, the palpitations, and you're feeling that lightness. Some people get lightheaded. If you get this out of the blue for no particular reason, then there might be an issue with general anxiety disorder, and it needs to get looked at. A lot of people have, in addition to those symptoms, they have that restlessness. They feel, or they describe it that I'm on edge, and also they get fatigued very easily. They get tired easily. This is also a telltale symptom of generalized anxiety disorder. Cognitively, they have difficulty concentrating. It's very important to concentrate when you're getting tasks at hand, but these people have very difficult time concentrating. And with that, they'll also get muscle tensions, and also they get stiffness of the muscles. Their ability to move at will decreases. So you have inhibition of mobility as well. Getting back to the cognitive side of things, these folks are also what we call irritable. They're very easily, their affect gets negatively affected very easily. So they're very irritable. They get quickly, they'll get mad, and they'll get bothered by things. And these things point to a generalized anxiety disorder. Their sleep pattern, I told you, they have sleep disturbances. They have recurring nightmares and flashbacks. This is something which points to generalized anxiety disorder. And, these are things to look for. Typically, when you go to your doctor, they'll get you, with a counselor. They'll get you some medications that kind of calm the mind, relax the muscles, because you're always tense. And when you're tense and when you're stressed, there's a hormone in your body called cortisol. That's your stress hormone, and it's always going to be high. And when that's high, most of your bodily functions will be altered, especially in terms of your metabolism. It'll be slowed down. Your glucose metabolism as well will be altered. You're going to have a lot of sugar in your body, which is not going to get processed properly. You'll have a lot of depletion of insulin in your body, which is supposed to utilize your sugar for energy, and that's not going to happen. You'll have, if it's something that's chronic, you'll get weight gain. That's normal with these types of issues. And again, the aches and pains, you'll get fatigue. A lot of people, for lack of a better term, they'll say, they have fibromyalgia, which means body aches all over, and it's unexplained. It's unexplained. You can't attribute it to an injury. So when these things happen, there's a higher stress or a higher cause, and we attribute it to generalized anxiety disorders. So that's important to keep in mind and to recognize in yourself or in others that you might take care of, whether it's teenagers or elderly or young adults. It's important to keep that in mind. You know, anxiety typically doesn't go away unless you really do some behavioral work on it. You can take a temporary medication to kind of calm you down, but that's temporary. It's not permanent. So we advocate, getting the cognitive behavioral therapy, which is something where it involves your mind and your behavior and your actions together. And once you sit in front of a practitioner who can counsel you and who can give you techniques to deal with the stresses, and it could be, starting with breathing techniques to activities that you do that can actually help you cope with those stressors, then your body will get to a homeostatic balance. That's important, because you don't want yourself to be always on that high cortisol and have that anxiousness and have that negative feeling about whatever issue it is that bothers you. And when it alters the activities of daily life and it prevents you from having a normal life, then it's very, very, very important that you seek help. And of course, when you seek help, you have the counselors, you have the doctors, you have the medications, you have the cognitive behavioral therapy. You have a bunch of things that can help you with these types of anxiety issues. And it's important, because if you leave the anxiety issue untreated, and if you leave and you recognize in yourself that you have anxiety disorder but you don't treat it, this will manifest in a biological form, in terms of some type of chronic pain, some type of deficiency in the body, some type of hormonal imbalance. It'll affect other aspects of your life, because our body systems are not isolated. It's all one body and it's all interconnected. So if it's interconnected, you have to make sure that your mind and your body, in terms of its health, are functioning complementary together with each other. And anything that affects your mind will affect your body, and vice versa. So there is that dynamic that you have to consider. And I would encourage you that if you have anxiousness that goes beyond the normal things that you can cope with, seek help. There's no taboo. There's no problem with it. Just as you would seek help with a infection of your lung, or a sore throat, or a cough that you might have, or something like that, you seek help with the doctor. With these types of anxious issues and anxiety disorders, there's nothing wrong with going to your doctor and telling them that, hey, I'm getting these types of anxiousness, which prevents me from doing my daily work, or prevents my sleep, or prevents me from taking care of my children, or prevents me from functioning at work. If these things are happening and you're getting irritable, your lack of concentration, you have withdrawal from social life, frequent worries that you can't resolve on your own, and it's very important to get help. If you need any resources, we can be of service. We have access to counselors and different doctors and services that you can take advantage of. We're here to help you. All you have to do is comment or privately access or call us, or what you can do is email us, and we can help you and help your loved ones come over these types of anxiety disorders and live a life that's filled with quality, and necessarily keeping all the negative thoughts and these normal anxieties that can get overwhelming, keeping them at bay and taking care of these things. Those are the things that we wanted to discuss a little bit about general anxiety disorder. It is something to take seriously. It is something to take care of if you see it manifested in your loved ones, and we're here to help you. And if you need any further if you have questions or advice that you need on it, please don't hesitate to contact us. With that, we'll see you next week. Thank you very much for your time, and hope you enjoyed the brief show. Thank you.